If you've been told that your MRI shows degenerative disc disease or a disc herniation, that can be scary. But what most people don't realize is that it's incredibly common, even in people with no back pain. Stick around, I'll explain it to you. So there have been studies done on pain-free people, people with no low back pain whatsoever, and it's pretty crazy. One study actually showed that half of those people had a bulging disc that showed up on their MRI. Okay, a quarter of those people actually had disc herniations on their MRI, and two-thirds of those people had some sort of abnormal finding on their MRI. Again, these were all pain-free people. So, what does that mean? That means that your MRI doesn't necessarily tell you where your pain is coming from. There's people like you and me or whoever walking around with these findings on their MRIs, but no pain whatsoever. So, we can't just assume that your MRI is telling you where you hurt. So an MRI gives you a snapshot of what your spine looks like at that moment. It doesn't tell you how your spine moves. It doesn't tell you the actual source of your pain. And that explains why you have some people with these awful looking MRIs who have no pain whatsoever. And then you have folks who go to the neurosurgeon or the orthopedic surgeon, they get an MRI report. The MRI shows nothing, but they're still in significant pain. And that's a very frustrating feeling. So the MRI just doesn't tell the whole story. Sometimes the MRI clearly correlates with what's causing the pain, but oftentimes it does not. So just like a car with a rusty engine can still run pretty well, your spine is the same way. You can have a spine with some wear and tear, and that doesn't mean that you're fragile or that you're broken. You can still have a very good life, a high quality of life, even if your MRI shows things like disc degeneration, arthritis, disc herniation, that sort of thing. What matters more is how you move, how you take care of yourself, and how your spine functions in your day to day living. That's one of the big takeaways from this research is that it's very common for people to have disc bulges, disc herniations, and either not even know it or they know it and they're still pain free. So there's people walking around every day with these findings on their MRI that are pain free. That's very common. Okay. It's not rare, it's common. So basically, you don't want to panic. Whatever your MRI finding is, don't just panic. Know that it doesn't necessarily mean that's the source of your pain. So your spine is strong, okay? It's meant to handle load, bending, twisting, lifting, and then recovering. That's what your spine is built for, an active lifestyle, okay? Additionally, most disc issues do improve without surgery. It's rare that a disc issue needs surgical repair. It's more common that disc issues heal on their own, and the science is there to back that up. So, what's what I want you to take away from this is that your body is capable of recovering, especially when you stimulate it with the right kinds of movements and activities. Your spine is just so resilient. So here's another way to look at it. If you've been pain free most of your life, then you start having pain. And soon after you start having pain, you go in to get an MRI. And that MRI shows degenerative changes like degenerative disc disease, disc bulges, disc herniations. Most of those findings did not show up overnight. Most of those findings have been there probably for years while you had no pain. There is the case of a car accident or a traumatic event that causes a sudden disc herniation, but for the most part, these findings are they've been there for a while. They've been brewing for a while. Okay, so if they've been there all along, and you're just now having pain, what does that mean? That probably means that whatever is there is not causing your pain. It's something else. So this should give you hope that your MRI could show stenosis or degeneration, and that does not mean that you're stuck. Okay, you can improve, and it starts with movement. If you're ready to take control of your low back pain, I do have a free video mini course. It's 4 back saving techniques for spinal stenosis, degenerative disc disease, and chronic low back pain. It's a good starting point to get you started to learn how to control your spine and reduce pain. I hope this video was helpful for you. I do appreciate you watching.